Hi friends, this is Dr. Anugraha here. So today's topic is tumor markers. All right, and you know what? I made English version of this video before this, okay? And the thing is, it didn't get recorded. Yeah, I mean it got recorded, but the slides were not moving. I was combining Op Studio, PowerPoint, trying to make it a little different from before, but didn't work out. So yeah, let's start. Tumor markers means, what are tumor markers? First thing, definition and the see, they are proteins made in our body in response to cancer cells. Even though it's a Malayalam class, I don't know how to put it in Malayalam, so I'll say that in English. Alright. So tumor markers and then they're basically proteins. Cancer around the body just a moment. Around the body cancer okay, our cancer cells sometimes they will produce high amount of proteins. But these proteins are tumor markers. So, the cancer cells produce the proteins. Because there is cancer in the body, the body will respond to it and produce abnormal amount of proteins. Okay, so those are called as tumor markers. Once again, what do you mean by tumor markers, dear? It is the proteins made by the cancer cells or by the body in response to cancer cells. Okay, now oro tumors oro tumor markers under, right? Very specific, like PSA high angle, you will think about, okay, what is PSA? Prostate specific antigen. Now PSA in blood, if it is very high, you will think of prostate cancer. Now see guys, this tumor marker, right? These tumor markers these proteins, they can be elevated, they can be increased in blood depending upon where the tumor is. Every tumor, urinary bladder tumor urine tumor markers. Okay, so tumor markers can be seen in blood, they can be seen in body tissues, they can be seen in urine, right? Okay, now let's talk about one by one, few one-liners. PSA is prostate specific antigen, and this tumor marker increases in prostate cancer. Now you will tell me, in a normal person, in a normal man, PSA level you will tell me. Okay, now if it rises to abnormal levels, then you will think about prostate cancer. CA125, what is that? Cancer antigen 125. Now if the CA125 is very high in a person, you will think about what? Ovarian cancer. What is it? Ovarian cancer. Now ovarian cancer, it has got different types. If CA125 is high, you will mainly think about epithelial ovarian cancer. And artham, see, if I am drawing ovary here, okay, namak ovaries under, right? Women have ovaries, and ovaries in the surface, the cells are all the ovaries in the surface, we have got epithelial cells, and that are epithelial cells. Now, these epithelial cells abnormally proliferate cheyidal, they will produce an antigen in the blood called as CA125 antigen, right? CA125. So, CA125 increases in epithelial ovarian cancer. Easy? Okay. Next, catecholamines. What do you mean by catecholamines? Catecholamines are nothing but hormones produced by the adrenal gland. Our adrenal gland kidney okay, these are the adrenal glands. Now these adrenal glands will produce hormones like adrenaline, that is epinephrine, noradrenaline, that is norepinephrine, dopamine. Okay, so these are called as what? These hormones are called as catecholamines. Now if there is tumor of the adrenal gland, then what happens? Yeah, there will be increased amount of these hormones, right? So normally adrenal gland producing the immunohormones, they will be very high. Okay, my light is off. They will be very high if there is tumor of the adrenal gland, and tumor of the adrenal gland is called as pheochromocytoma. What is it here? Pheochromocytoma. Okay, that's very important. Actually, pheochromocytoma is individual question on theory papers, competitive exams. We'll talk about it when we go to endocrine. Fine. Now this is very important slide. CA99, this tumor marker, it increases in pancreatic cancer. Very, very important. Has come multiple times. See, how will you memorize it? In 9 ningal ezhudumbam, okay? നേരെ തിരിച്ച് ഒരു മിറർ ഇമേജ് ഓഫ് 9 എങ്ങനെയായിരിക്കും? ദാ ഇങ്ങനല്ലേ, P പോലെ. അപ്പം with that, okay, with this code you will remember CA19-9. Okay, if this tumor marker is high, you will think about pancreatic cancer. You will think about what, dear? Pancreatic cancer. Okay, now next one. Yeah, beta HCG. If beta HCG is very high in a woman, you will think about choriocarcinoma. See, choriocarcinoma endada? See, choriocarcinoma, it is a tumor of the placenta. Usually ectopic pregnancy അല്ലെങ്കിൽ molar pregnancy like we get to see this. Sometimes we get to see the choriocarcinoma. Okay, but it's usually mostly എപ്പോഴും നമുക്കത് gestational ആണെന്നും പറയാൻ പറ്റില്ല. Non gestational choriocarcinoma ഉണ്ട്, right? Okay, in the ovaries and all that. So yeah, beta HCG rises in cases of choriocarcinoma. Fine. Next one, alpha fetoprotein, AFP. AFP rises in these three conditions. These three you should know at least. AFP kodiala, you will think about yolk sac tumor, hepatoblastoma and hepatocellular carcinoma. See, yolk sac tumor anda, it is a germ cell tumor, meaning yolk sac tumor ennu vechala, you know, it is a tumor of the ovaries, of the testis. That is yolk sac tumor. So avade alpha fetoprotein is going to be high. Hepatoblastoma എന്ന് വെച്ചാൽ നമ്മുടെ ലിവറിൻ്റെ മാലിഗ്നന്റ് ട്യൂമർ ആണ്. യൂഷ്വലി ഹെപ്പാറ്റോബ്ലാസ്റ്റോമ മീൻസ് ഇറ്റ് ഈസ് എ മാലിഗ്നന്റ് ട്യൂമർ ഓഫ് ദ ലിവർ സീൻ ഇൻ ചിൽഡ്രൻ ലെസ് ദാൻ 3 years of age. അതിനെയാണ് ഹെപ്പാറ്റോബ്ലാസ്റ്റോമ എന്ന് പറയുക. ഇറ്റ് ഈസ് എ മാലിഗ്നന്റ് ട്യൂമർ ഓഫ് ദ liver. Next is HCC. See, same thing. HCC എന്ന് വെച്ചാൽ it is a malignant tumor of the liver seen in adults. Chronic infections, hepatitis B, C, പിന്നെ വിൽസൺസ്, ഓക്കെ, നോട്ട് ജസ്റ്റ് ഇൻഫെക്ഷൻസ്, വിൽസൺസ്, ഹീമോക്രോമറ്റോസിസ്, ഇങ്ങനത്തെ ക്രോണിക് ആയിട്ടുള്ള പേഷ്യൻസിന് നമ്മൾ we get to see what? Hepatocellular carcinoma. Okay, so ഈ മൂന്ന് കണ്ടീഷൻസിലും you will see that alpha fetoprotein, that is a tumor marker, alpha fetoprotein rises. Very, very important. Okay, the next one, calcitonin. See, calcitonin എന്ന് വെച്ചാൽ this is a thyroid gland. I can't enlarge it, okay? This is PowerPoint, so I can't enlarge. That's what I miss from, you know, the other way of teaching by using Google Meet. In that, I can enlarge the pictures and show you, right? Yeah. Fine. See, calcitonin, it is a hormone. First thing, what? Calcitonin and the other hormone, ana. It is produced by the thyroid gland. Okay. Now, if calcitonin is very high in the body, you will think about thyroid carcinoma. Itra manasilayo? If calcitonin is very high in the body, see, calcitonin is produced by the thyroid gland. Calcitonin valare high anengil, you will think about thyroid carcinoma. Now look here. See, thyroid nathu we have got follicular cells, okay, and parafollicular cells. All right. Ee parafollicular cells neana I can't write in PowerPoint so well. You know, the other one actually I can write well. But that is little time consuming, little compared to this. That's why I thought I'll use this way of teaching. Anyways, parafollicular cells of the thyroid. Okay, parafollicular cells of thyroid ആണ് നമ്മൾ C cells എന്ന് പറയാം. ഈ C cells ആണ് എന്ത് പ്രൊഡ്യൂസ് ചെയ്യുന്നത്? കാൽസിറ്റോണിൻ എന്ന് പറയുന്ന ഹോർമോൺ പ്രൊഡ്യൂസ് ചെയ്യുന്നത്. ഇത്രയും മനസ്സിലായോ? ഓക്കെ. നൗ ഈ C cellsന്റെ അബ്നോർമൽ proliferation or C cellsന്റെ ക്യാൻസർ ഉണ്ടാകുമ്പോഴാണ് നമ്മൾ മെഡുലറി കാർസിനോമ ഓഫ് ദ തൈറോയിഡ് എന്ന് പറയാം. എന്തുകൊണ്ടാണ് മെഡുലറി കാർസിനോമ എന്ന് വിളിക്കുക? സി, ഞാനിപ്പോൾ ഒരു തൈറോയിഡ് ഇവിടെ വരയ്ക്കാം. ഇപ്പോൾ തൈറോയിഡ് ആണ്, നിങ്ങൾ ജസ്റ്റ് അസ്യൂം ദിസ് ഇസ് എ തൈറോയിഡ്. ഓക്കെ, നൗ ദ ഇൻസൈഡ് പാർട്ട് ഓഫ് ദ തൈറോയിഡ്, ഓക്കെ, I can't change the color also. Okay, no issues. See, the inside part of the thyroid, that area is called as the medulla of the thyroid, the inside part. Okay, now inside part ilana endullathu nammada parafollicular cells ullathu, allengil nammada parafollicular cells neയാണ് C cells ennu paraya. So this medulla of the thyroid has got, medulla means the inside part of the thyroid has got parafollicular cells or C cells, and these C cells, they produce calcitonin. Now, these C cells, okay, medullailulla C cellsinaanu cancer ullengil, increased amount of calcitonin is going to be produced, and since it is in these C cells are in the medulla of the thyroid, we call it as medullary carcinoma of the thyroid. Understood? Actually, thyroid nu pala tarathilulla cancer undu, papillary undu, follicular undu, anaplastic undu, so on. So if calcitonin is very high, Okay, then we call it as medullary carcinoma of the thyroid. All right, let's do one question and wrap this up. A 55-year-old man presents with weight loss. Okay, weight loss, abdominal pain and jaundice. On investigation, he's found to have a mass in the head of the pancreas. See, a mass in the head of pancreas. So, mass in the head of pancreas, weight loss, all of these point towards what, dear? Cancer. Okay. Now, the question is, which of the tumor marker is most likely to be elevated in this patient? Look here, first thing, you will tell me what is the diagnosis. See, it's very clear-cut answer. Diagnosis, mass, they saw the mass in the head of the pancreas. So, definitely it is a pancreatic cancer. See how simple, man. Pancreatic cancer. Pancreatic cancer, what is the tumor marker? P. You will remember CA, yeah, here, CA 19-9. Okay, this 9 in the mirror image in the P. 9 flip P, there is a P. CA 19-9. It is a tumor marker for pancreatic cancer. So that's what they have asked here. What is the tumor marker for pancreatic cancer? The answer is 3, CA 19-9, right? So that marks the end of slides. I'll see you in the next class, and I hope this class got recorded. Stay blessed, guys. Stay happy, stay healthy, drink lots of water.